Good afternoon. I'm Dr. Michael Zappa, Chief of Emergency Services and Associate Chief Medical Officer here at Cape Fear Valley Health. I am pleased to be with you today as we prepare for Phase 1 of lifting restrictions that have helped us flatten the curve of the COVID-19 pandemic. I would like to start with a brief update on the numbers. In the United States, there are over 1.2 million confirmed positive cases of COVID-19, and there have been, unfortunately, over 73,000 deaths. In North Carolina, there are approximately 14,000 cases and just over 500 deaths. Locally, here in Cumberland County, there have been 342 confirmed cases and 9 deaths. So how do we know the curve is flattening? The number of new cases per day is decreasing, and more importantly, the number of people hospitalized is steady or decreasing. As of yesterday, across the state, there were 515 patients in the hospital for COVID-19. Here at Cape Fear Valley, the number of confirmed positive patients requiring hospitalization has remained under 20. This is very good news. This was not an easy task, and it took all of us working together to accomplish this. We have been washing our hands, maintaining social distancing, and using masks when around others. It is these good habits and their positive results that have kept us safe and healthy, enabling us to begin relaxing some of the restrictions we have had to live with over the past couple of months. Two very important changes in the restrictions at the hospital are the reopening of necessary elective surgeries and procedures that started this week, and the allowance of care companions to be with patients in the emergency department that starts today. This COVID-19 pandemic is not behind us, so it would be unsafe to remove all visitor restrictions at this point. But we have created a very specific, safe process to permit care companions to join their loved ones in our emergency department. A care companion is someone that is willing to stay with you during your entire emergency visit and is knowledgeable about and privy to your personal health information. It is not a coworker or a neighbor who is being nice and giving you a ride to the hospital. Upon entry to the emergency department, the patient and their care companion will be screened. Each will be asked if they've had a fever, cough, or shortness of breath. They will be asked about travel to any identified hotspots. They will be asked if they have been in close contact with someone known to be COVID positive or if they have been previously tested for the virus. They will have their temperature checked. If the patient screens positive for any of these, they will be isolated and evaluated. If the possible care companion screens positive, they will not be allowed entry. If they do pass the screening, they will have an orange wristband placed and provide their cell number and instructed to wait in their car until their patient is in a private emergency treatment room. In order to keep everyone safe, we are not allowing care companions to be in the waiting room so that we can maintain appropriate social distancing. Oftentimes the wait will be under 30 minutes, but during busy times it could be an hour or two. The care companion will be called by the patient's nurse when the patient is in their private treatment room, and they will be escorted directly back to stay with them for the rest of their emergency visit. If the patient requires treatment beyond the emergency department and needs to be admitted, the care companion can stay until the patient is transferred to another ward in the hospital. As of now, the visitor restrictions are still in full force for the remainder of the hospital. One of the reasons the emergency department is taking the lead on safely modifying these restrictions to allow care companions is to assure that patients feel safe and supported when coming to our emergency department. Although we have emphasized over the last couple of months the need to stay home except for essential functions, such essential functions as obtaining food, medicine, and health care, the number of people seeking emergency care is significantly less than usual. Some people might postulate that these visits must have been unnecessary. but some recent statistics are very concerning. In Cumberland County, the out-of-hospital cardiac arrest rate has risen 40% in the past month. That's the number of people that suddenly drop dead and are unable to be resuscitated. That translates into more deaths than from COVID-19 itself. So it is because of this that I remind everyone that our hospital is one of the safest places to visit. All of our staff use appropriate personal protective equipment. All patients and care companions are required to wear masks. With such an increase in cardiac arrest, I feel compelled to remind everyone of the warning signs of heart disease and heart attack. First of all, there's chest pain, but it is not always pain. Sometimes it's pressure or heaviness, heartburn or indigestion. There can also be jaw pain, shoulder pain, arm pain, or upper back pain. Other warning signs are weakness, sweatiness, nausea, or vomiting. So please, don't ignore the warning signs. If you're having such symptoms, come and get checked. As we say, time is muscle, meaning heart muscle. Time is also critical when it comes to preserving your brain when a stroke occurs. May is Stroke Awareness Month, so watch out for the warning signs of a stroke: headache, weakness, slurred speech, confusion, facial droop, arm or leg weakness, dizziness, loss of balance, trouble walking, or even passing out. If you're experiencing any of these symptoms, don't delay. Call 911 and get to the emergency department. As we continue to deal with COVID-19, remember we are not out of the woods yet. Even though the stay-at-home order is lifted, if you have mild COVID-like symptoms, please stay home. As a reminder, the common symptoms are fever, chills, body aches, headaches, sore throat, cough, and shortness of breath. There is still no treatment, so if your symptoms are mild, you do not need to be tested, and it is perfectly okay to stay home. If you are having trouble breathing or experiencing confusion, then you need to come to the hospital. An important final reminder for the elderly and those with chronic medical conditions: please continue to stay at home as much as possible. I want to thank all the heroic nurses across this great country, especially this week, National Nurses Week. And a special shout out to my team of nurses here at Cape Fear Valley Health. They are the ones taking care of all of our patients day and night. They are the ones that make us doctors look good. And to the community, I want to thank you. Keep doing your part, and we will continue to be here when you need us, 24/7, 365 days a year.